Today, finally, Health and Human Services Secretary Kathleen Sebelius will step before Congress to answer questions about the disastrous Obamacare rollout and the plan as it's becoming exposed. What can we expect?
Well, according to her prepared remarks that we have already eyeballed, more of the same. The Secretary plans to point the finger at the contractors that they hired. And joining us right now from Capitol, and that's a part of her statement, from Capitol Hill is Congressman and the Chairman of the House Energy and Commerce Committee, Fred Upton. Congressman, good morning to you.
Hey, it's still Fred. Good morning.
Fred, good morning to you. We've already heard she's going to blame the contractors. Don't blame me, blame them.
You know, the contractors told us last week that, in fact, they had the number of people who had enrolled. So there's no reason for this, the most transparent administration in history, according to them, for them not to share those numbers with us. One of the things that we're very concerned about is more people have received a cancellation notice than have actually signed up for the Affordable Care Act or Obamacare.
Yeah. What number do you have on the cancellation? We hear it's in the millions.
Well, I think it is probably in the millions. It's certainly in the hundreds of thousands. Sure. I know that every one of us on the committee has heard from people who've been told in a letter that their policy is canceled. I introduced legislation earlier this week that we hope to have on the floor soon, co-sponsored already by more than 50 folks, that says if you had a plan, you will be grandfathered. We'll keep the president's pledge. If you had a plan in January of this year, right, you don't have to be canceled. You can have it throughout next year, too.
Sure. You know, Fred, so many Americans were just shocked when they discovered in the last 48 hours that they got the cancellation notices because the president was very clear. If you like your doctor, you can keep it. Yeah. If you like your insurance, you can keep it. Well, as it turns out now, that looks like a lie.
And when they try to sign up for this, if they're finally able to, and the website was shut down again yesterday, as it was Monday, as it was over the weekend, they're finding that their premium increases are as much as 100%, even 400% increases, right, and the deductibles are going up in the thousands of dollars as well. That's not in the pledge. If you like your health insurance, you can keep it.
So you're drilling down on this. You're drilling down on this, Chairman, and you want to find out today who changed what? What's your question?
Why did they change? Why did they make these regulatory changes? Who decided to do that? And did they tell the president?
Oh, you tell me that the
plan that passed,
the plan that passed changed after it passed?
It did. When it was signed into law on March 23rd, 2010, it grandfathered existing individual plans. Later in the summer, I want to say July, a regulation was changed that, in fact, they knew would undermine probably as much as 50, maybe even 60% of the individual plans. And yet the president was still out on the hustings saying, look, if you like your health insurance, you can keep it. In fact, we know that that's not true for hundreds of thousands of Americans who are going to their mailbox and finding that cancellation notice last week, the week before, next week. It's not a good thing.
Yeah, Fred, do you worry that part of the grand plan, and I know you guys on the Republican side weren't in on it, was to go ahead, get a bunch of these low-cost insurance policy holders, force them through cancellation into the public exchanges so that the Affordable Care Act will be a success?
Well, that could be. I mean, we've had a dozen oversight hearings on this. I mean, it all started when, of course, they assured us, they looked us in the eye and they said, you know what, the rollout's going to work just fine. Yep. But, of course, as we've learned, they've got so many subcontractors, they never actually tested line from one end to the other until a week or two prior to October 1st, and the system crashed, as it is still doing. A pretty disastrous start, to say the least.
Well, and for those who say this is exactly like the prescription plan that President Bush put forward, what did you say to that?
Well, there's one big difference. The prescription drug plan, which I voted for, allows for choice. You're not forced into something if you don't want it. Dozens of plans are available in most states. An individual, as their health needs change, they can change from one plan to another, and they're not forced to participate as they are. Actually, you're not only forced into this plan, you're actually fined if you don't sign up.
Sure.
How is that an American idea?
Good point. I'm sure you got lots of good questions on both sides of the aisle for the Secretary.
I wish I had more than 4 minutes, too.
Yeah, no kidding. Fred Upton, the chairman of the House Energy and Commerce Committee. He's going to be presiding 40 minutes from right now on Capitol Hill. Congressman, thank you.
Thanks.
And the world will be watching.